right at the start of the process, which is now, wow, 2019. We did a really energized workshop with some of our service users and carers to define what good quality, what a good quality experience really looks like and feels like in terms of community services.
I think the involvement from the team that supported us through it, with actually sitting down with us and developing the ideas and projects as opposed to doing it for us, was really beneficial.
Coming from a point of view of looking at it as part of the employment specialist team, I think to see us kind of represented and being brought into the conversation by other clinical colleagues, and seeing that kind of culmination of a piece of work that's been done over a number of months, all around bringing parts of the service together. And I think it's us being a part of the service, which sometimes would have sat maybe on the side, but now being brought right into the middle with transformation, was a really good part for me.
I think the biggest achievement of community transformation is collaborative working, particularly collaborative working that provides an offer of holistic support for service users and their carers.
For so long, I've recognised that the recovery model we've had in Wandsworth has been very clinically focused. We've either had doctors, community psychiatric nurses, social workers, or OTs. But in fact, the addition of the peer support workers gives that extra dimension of both lived experience, but also making sure that the real life challenges of our patients are addressed.
The process has changed, how quickly people got used to the new ways of working. I think how quickly the pharmacists were embedded in the teams, and how quickly and effectively we were able to move from mobilization to business as usual.
Well, within my borough, it's certainly led to better communication between not just within sort of the treatment team, so the IRH and the SPA, but also a better interface between primary and secondary care.
For me, the biggest challenge is probably linked to the biggest achievement. It's that you are bringing lots of different people together, different organisations, different cultures, different backgrounds, and that takes quite a lot of working through, really.
The biggest challenge would be the change in culture. So change, however small or big, is always a challenge, and I think doing something in such a big such a big project was a real challenge, because there were multiple things we had to kind of keep an eye on and change and introduce. So the culture change, I think, was absolutely massive.
Yeah, the challenge was bringing people together at a certain time and just to talk about things, yeah. And also to talk about it in a systematic way. Yeah, I think that's been a big challenge, the coming together of different people and hearing each other.
I think the biggest difference for service users and carers is the access now to a wider range of supports, particularly social supports, which we know are significant factors in somebody's health and well-being.
When I first was in the service and being passed around and having to share your story again, but I've seen a lot of changes. It has improved the service for a lot of people in my situation back then.
The real difference of the community transformation is that the community finally feels heard and feel to being in control and have active participation in their care plan.
And transformation is ensuring carers, friends, and family are an important part in someone's recovery, and that they also have resources to look after themselves and their well-being.
What I'm most proud of in the community transformation work is the way we've genuinely formed a partnership across not just the healthcare sector, i.e. the doctors from GP land and from mental health land, but actually all the partners, the voluntary sector, the local authority, public health, the carers centre, the Wandsworth Community Empowerment Network.
Make a difference again, really proud to make a difference to people's lives and how that impacts on the quality of their life.
So I'm proud of the fact that the clients are going to be put at the center of their care and they'll be more involved.